Hello, and thank you for watching this update about the Juniper Community Care Hub. I'm Mark Cullen, Vice President of Strategy and Business Development at Trellis. First, I want to express my deepest gratitude to each of our partners. Whether you provide services as a Juniper partner, fund this work, or have advocated for the need for expanded access to social care, we appreciate you. You're the heart of this work, and we're proud to have you as part of the Hub. The Hub is really our collective hub. It'll only work if we do this all together. Now, we've had an eventful few years. The COVID-19 pandemic and related stimulus spending have spotlighted Minnesota's unprecedented need for social care services. We've benefited from large investments of public dollars in our work. And thanks to those dollars, we've addressed many of the needs we see in our communities, though we all know the persistent gaps remain. As we look ahead to 2025 and beyond, we know these funding levels won't be sustained, placing new pressures on our sector and, most importantly, the people we serve. Now, we think a two-pronged strategy focusing on advocacy and seeking new revenue sources is essential to going forward. We know many of you agree, and so at the end of this video, I'll give you some action steps that we can take together to improve our odds of receiving support during the upcoming legislative session. Now, the concept of a social care hub that integrates with healthcare organizations is relatively new, though elements have been discussed for years. This approach holds promise for showing the value of social care in generating new resources to support the work. The hub centralizes administrative capabilities necessary to integrate social interventions into a care plan developed in partnership with healthcare providers after events, such as hospital discharges and emergency room visits. The hub facilitates and coordinates referrals by enabling technology, referral management, contracting, analytics, billing insurance or other payers, and managing certain risks associated with delivering these services. In the future, the hub could also provide new payment models that would offer additional dollars when we help our neighbors achieve specific health outcomes. Now, of course, not all social services should or can address a health need, but some certainly do. And when they do, and a health insurance company or a healthcare provider receives a financial benefit for the improved population health management, we believe the social service provider should share in that benefit. Of course, the infrastructure necessary to facilitate those partnerships and related payments isn't well established. That's what we're building together. In the future, many of the business operations that we see in traditional healthcare will need to be applied to the hub and our work. I won't promise that this will be easy or fast, but we can do this. We know it because we are doing it. Now is the time to bet on ourselves and expand this work. Hubs that integrate healthcare and social services began drawing attention in 2022 when an article published in the journal Health Affairs highlighted the work of hubs in several states, including New York, Alabama, Massachusetts, and Virginia. Since then, evidence has begun emerging showing these hubs and the social services they offer can significantly reduce the total cost of care by reducing avoidable emergency room visits, hospitalizations, and length of stay, while improving performance on specific healthcare quality measures. In North Carolina, a demonstration of this type of integration saved the state $85 per beneficiary per month in its pilot, after accounting for the cost of the social services provided. With our state's long-term budget outlook appearing tight, Minnesota is well positioned to use the hub strategy to address the present and future long-term costs of care that the Minnesota Department of Human Services expects to grow by 70% between today and 2035. Now, as a part of this work, we're focused on securing a one-time $8.9 million appropriation to grow the hub, enabling the investment in services and technology and analytics that the community organizations need to enter the space and show our value. The bill is jacketed but not yet numbered, and we're actively working to introduce it in the Minnesota Senate and House committees with jurisdiction. The funding allows a multi-year demonstration of the hub and its capabilities, showing the near and long-term value that social services in Minnesota can create. Showing a multi-year view of that value is important to evaluate the true savings that we create together. This bill would fund the Community Care Hub infrastructure expansion and pay for services delivered as a part of the hub. Community-based organizations offering services as a part of the effort will qualify for dollars associated with these activities. We've already connected with several key legislators, but we know their strength in numbers. If you have connections with your local state legislators, we'd love to have your help in introducing them to the Community Care Hub. Together, we can build relationships needed to make this vision a reality. Our vision for the Community Care Hub is unlike anything in the country right now due to the statewide and multi-service offerings we envision. No others in this space have a statewide footprint or successfully integrated a wide range of services. Also, we're committed to providing payment for services, not just payment for screening and navigation. Together, we're bridging a critical gap between healthcare systems and community-based providers like you. While we hope the funding received through the Community Care Hub will help cover the operating costs with a small margin, we also expect that these dollars will not solve our collective major budget challenges alone. Instead, we think these dollars are part of a braided funding model that will prove stronger over time. We are committed to identifying new revenue streams that complement rather than replace the funding already supporting your work. These will be entirely new dollars, not a reallocation of the existing resources, ensuring we address core challenge without merely shifting priorities. And so to that end, I'm asking you to take the following action. Please get in touch with your local Minnesota House and Senate representatives to share your story. Tell them about the important work you do to support your neighbors and let them know you're ready to do more through these healthcare partnerships. They need to know that the service levels can't be sustained without additional dollars and new alliances. Share the hub concept and what it would mean for your organization. If it's helpful, we're glad to join you in these conversations. Here are some talking points you can use. We are seeking a one-time appropriation that would enable the expansion of our hub infrastructure and position community-based organizations throughout Minnesota to offer more social care services to our neighbors. Emerging evidence in many healthcare journals shows that social services provided to people experiencing an episode of care can dramatically impact the cost of that care. The state of Minnesota should invest in this infrastructure because long-term care costs are expected to grow by 70% between now and 2035. The Own Your Future report released by DHS in 2023 specifically advises the state to consider home and community-based services initiated early in a care situation as a strategy to reduce these impending costs. The growth could be a budget buster if we don't act now. Minnesota should leverage its investment in community-based organizations. We already have one of the strongest nonprofit social service environments in the country. Let's build on this strength together. Now here's what comes next. In 2025, the legislative session starts on January 14th. As we prepare for the legislators to gavel in their respective bodies, we will meet with the legislators to seek their continued support and select bill authors. As our bill moves through committee hearings, we will ask you to email, call, and engage your legislators. Often, we won't have much lead time before the hearings begin, so please be on the lookout for messages asking for your help. And please let us know if you'd like to join us in meetings with your legislators. We'd love to have you join us in these conversations about how our collective vision will help your area. Together, we're building a stronger and more connected future for the people we serve. Thank you.